It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit petlife.ie.
Okie dokie, right, it's getting to that time of the year. I know it's the 15th of October and we're a couple of weeks away, but I think now is the time to get ready to get your animals sorted when it comes to Halloween, because I'm beginning to hear fireworks going off at 2 or 3 o'clock in the morning. There's bangers going off, and I was kind of, my cat, who usually stays out at night, especially during the summer months, was kind of looking to come in more late over the last couple of days or so. And is that normal?
Yeah, well, John, I think if we plan ahead, John, and begin to talk about Halloween and the possible disruption to pets caused by Halloween, and help people put treatment plans in place, whether it's medical or herbal, or a change in management, change in routine of your pet, but to start thinking about it now a fortnight out. In previous years, maybe I've left it a little bit too late to start talking about Halloween and to try and help pet owners plan for Halloween. But I think we need to start thinking about it now. The bangers have started already in certain places.
Yeah.
And pets are getting upset. They're going off their food. They're getting agitated. There are medical and herbal options. And I think if we start the pets on them at a low dose, and they're calmer and they're chilled, and they'll be happier for the next fortnight.
So what you're saying, you're building up to it now?
I think that's the way. We've in the past, we've discovered that if you have an animal that's upset about something, whether it's travelling or a sudden disruption, you give them a one-off treatment, it probably won't work. You'd nearly have to sedate them, knock them out completely to get them through Halloween night.
Yeah.
So in terms of making sure that they're calm and treating their anxiety, we want to be starting a fortnight out.
I think that's a great idea, because it gets them used to the idea of the drugs and the reaction to them as well. Are we talking about what animals are we talking about? Predominantly, it is cats and dogs, really, isn't it?
100%, yeah, cats and dogs. So obviously larger animals will be indoors, horses and so on, and other types of pets, they'll be indoors. Little small furries, hamsters, rabbits, gerbils, no, they won't be bothered as much because they're purely indoors, they're insulated from it. Dogs and cats are aware of the outside world, and they're creatures of habit. They don't like change. And they don't like distress. No, they don't like distress. And so the buzzword really now, the whole name of the game is all about anti-anxiety. It's all about treating anxiety. So that's what they have. They get anxious, and we're able to treat anxiety by working on their adrenaline levels and their cortisol levels, rather than just having to. It's not just a case of having to sedate them.
But you touched on the outset there of herbal. So is that typical herbal remedies that are quite successful? Yeah,
animals they seem to respond very well to certain amino acids. Vitamin B1, thiamine, has a calming effect, and there's a couple of others, which are in the herbal capsules, and they can be effective, but you have to put a loading dose in place, and you have to use plenty of them. Now, a nice brand I like that's working well for us, NutriCalm, and they're a good company that make this blended amino acids substance in a capsule, which has a calming effect, and it'll just take the edge off them. But as I say, you do have to put a loading dose in place, and you want to be giving it for a couple of weeks.
Yeah. I think that's the key to it as well. How did they react to it going on the calming initially? I mean, cats and dogs, what does it do to them? Does it literally calm them down?
Yeah.
Or does it just make them less aware of what's going on?
It makes them calmer. So the beauty of it is now that we've moved away from sedatives, and we have these drugs that work on their serotonin and work on their adrenaline and their cortisol levels. So raise their serotonin so they're happier, lower their cortisol and their adrenaline. So anti-anxiety medication. They're not sedated. They're just a little bit more chilled out. They're a little bit less agitated, a bit less anxious.
Okay, so before, where they could be cowering and they could be maybe just getting totally stressed this time round, it just might take 50 or 60% off the edge as well.
Exactly.
And that makes the difference, though, doesn't it?
See, now the herbal thing, for instance, 50% or 60% of an edge off them, John, makes a difference, as you say. Exactly. Yeah. And the NutriCalm might do that. Now, if you have a dog in particular that's more distressed, probably a more high drive, more anxious type of dog, right? Think about what a very anxious person would take, something along the lines of Valium. So we have an equivalent cocktail called a trazodone gabapentin capsule. Excuse me.
Yeah, you're okay.
Combination. So the trazodone gabapentin combination for dogs, and that's not sedating, it's just mildly calming. Excuse me.
You're okay.
Secondly then, with regards to anti-anxiety medications, here's a whole family of drugs that a lot of people have to take for different stresses. The SSRI drugs. Now, SSRIs work on your serotonin. They don't sedate you. They don't lower your blood pressure, anything like that, but they raise the serotonin levels in your brain so that you're less anxious. So we have an equivalent for dogs and cats, which I used to actually doubt the efficacy of them because, hey, they're not as cerebral, they're not as self-aware as people. But I have actually found, lo and behold, that since a dog-specific SSRI has been created, been developed, we're seeing evidence that it does work.
Yeah.
It genuinely does work. So the human drug of what I'm talking about here, the SSRI, is Prozac.
Yes.
Now that's a common.
Everybody knows Prozac.
Prozac, yeah. So the doggy Prozac is called Reconcile.
Okay, right.
Yep.
And it works.
It does work. Again, I used to be sceptical about the potential benefits of these, but I'm seeing the evidence of it now, and I like the Reconcile. And we're definitely finding that dogs' quality of life is improving.
Okay, so would that have a good effect then, in a positive way, on highly strung dogs?
Yeah, John, that's just to broaden the conversation. It works for lots of fear-based and anxiety-based behavioural problems. So it can work for inappropriate aggression.
Yes.
Inappropriate destructive behaviour.
Right.
Or house soiling.
Yeah.
Or inappropriate barking.
Right.
Yeah.
And at the same time, broadening a little bit further, would that type of drug would also be used for maybe dogs that are anxiety about travelling and moving? As you look, I mean, you were lucky you were able to take your dog on the boat going away, but I'm talking about other dogs who want to fly them somewhere, bring them somewhere.
Yeah.
Was that the type of drug that you'd give them?
It is, yeah. And you know what? You can cure them of travel stress by doing this, by putting them on these medications for a few months.
Yeah.
And the reason why it can actually cure them is because dogs are creatures of habit.
Yeah.
So sometimes changing the behaviours over a sustained period of time has a complete change, a completely transformative effect on the dog's both behaviour and psychology. So think of it this way. If a dog behaves in a particular inappropriate way for weeks and weeks and weeks on end, every day, then that's a formed habit.
Right.
It's a set behaviour. And that behaviour will continue as long as the triggers are in place. Now, if I put a dog like that with all of those bad behaviours and all of those triggers, if I put that dog on an SSRI, on the Prozac, on the Reconcile, and it raises his serotonin levels and lowers his anxiety levels, and hey presto, he stops the inappropriate behaviour.
Yeah.
Right? And his brain stops responding to the triggers. Okay? After a period of about 90 days, about 3 months, right? That habit, that behaviour is broken.
Yeah, that makes sense.
And because they're creatures of habit, we are then able to wean them off the medication. And the bad behaviour, 9 times out of 10, doesn't come back. Isn't that amazing?
It is amazing, yeah.
Yeah.
Yeah, absolutely.
So that's what we find with dogs, because their behaviours are so trigger-based. Whereas a human behaviour would not be trigger-based. A human might be on an SSRI for a particular type of anxiety, and if they stop it unexpectedly, take themselves off it suddenly, the chances are the panic attacks, the stress, all those factors will come back within a month for an anxious person.
Yeah.
An anxious dog, not so. The behaviours, 9 times out of 10, will not come back.
That makes sense as well.
Yeah.
It definitely does make sense, yeah. Okay, some questions coming in. We have a 2-year-old Golden Cocker Spaniel who is always anxious, even in the back garden, not just during the Halloween weeks, but generally. He kind of cowers a little, well, they're using the word I used there a second ago back, when people approach him. We don't know why, because he's never been in any trauma, and he's very well treated. Yeah,
okay. That's a really typical situation. I would see that in the practice, honestly.
Oh, yeah.
I would, every day. Okay. Golden Cocker, it just rings so many bells for me.
Right.
So they're a working breed.
Yeah.
They're descended from a very high drive and a very high vigilance working dog.
Okay.
And so all of their working instincts are still in place, but without the opportunity to express that by doing the functions that they've been basically evolved to do. This spills over and becomes a type of anxiety.
Yeah.
And these dogs then display inappropriate fear, inappropriate worry, sometimes inappropriate destructive behaviours.
Yeah.
So, couple of things you can do for that dog. Worst case scenario, he needs to reconcile for his anxiety. But way before you get to the reconcile, look to put a more involved and a more active exercise plan, exercise daily routine in place for that dog. He might need 90 to 120 minutes of really solid exercise per day in order just to lower his cortisol levels, lower his work drive and chill him out a little bit. So you have to think of it that this is a working dog and his instincts are not being expressed. You have to lower his drive by giving him an opportunity to express his natural instincts, and that might mean an hour down the canal morning and evening. It could take that.
But golden cockers are also a great family pet, aren't they?
They're a good family pet. They have no badness in them. They're not nasty in any shape or form. They're very social. They just have a high drive. The two instincts there would be high drive, high prey drive, which is busy and look for things to do. And the other instinct they have is hypervigilance, like a guard dog. Excessively watchful. So then they're excessively reactive to people and changes.
Yeah, that makes sense as well. Okay, we have a 5-month-old kitten with a swollen bottom lip. He lost his first baby tooth yesterday. Is this swollen lip to be expected, or should we take him to the vets? Do they usually use their teeth?
Yeah, they do lose their teeth.
Okay.
Swelling around the face like that wouldn't be a normal thing that you'd see, with
especially the timing of the tooth coming out as well at the same time.
I wonder, did he get a bang or a knock? Is that some type of a trauma?
Yes.
Do you know what, listener, as well, your cat is old enough to neuter.
Yeah.
So I think you make a little appointment there with the vet and have the neutering done.
Because if he hasn't been neutered and he could have been involved in fights or something at a 5-month-old, and there could be some aggression going on.
Exactly. Now I'm just thinking that straight away. He could be fighting. There could be a bruise or a bang on the face because of fighting. Have him into the vet, and let's see about getting the little bit of a bang on the face looked at, and maybe get him neutered at the same time.
Okay, Susan, thanks for that. Or Sue, I think it says Susan Bunyan. Thank you very much. If you want to just maybe contact your local vet or Des or any of the team, they'll certainly take a look at your 5-month-old kitten. But maybe that's what the problem is. If he's out and about, he's probably just getting into bother with some of the others. If not, or you think if there's redness or some, if there's any, would it be worthwhile checking the lip area anyway? If she's saying it's swollen,
have a look inside the mouth, listener, just out of curiosity yourself, and see what you can see.
And if there is more redness than all,
your eye will tell you what's going on there.
Yeah.
Is there a cut or a bruise or a bang or a bite or whatever, and then have a chat with the vet about it.
All right, somebody just sent me in a lovely picture of, hi, good morning all, Tig here, loyal listener to KFM, love the goal, the slot that you do. These are my 3 Jacks, Jack, Lola and Alfie. Just a quick question, 2. We go for a hike most weekends, and a few weeks ago I bought cod liver oil tablets for the animals. Is this okay? One tablet each, I think. Also, my dachshund developed a sore on his front paw elbow from the harness I'm using. Could Des recommend a harness for the dachshund, please? There's a family of animals and lovely animals.
Three lovely tricolours.
Yeah.
Yeah, healthy. Okay, so the harnesses, you go into the good pet shops and there's a model of harness which is quite pricey now. Could cost you around the €40 mark, but it's shaped like the saddle, literally shaped like a saddle of a horse.
Okay, yeah.
So those ones are really good. The best type of harness, the ones that are shaped like a saddle. Mm-hmm. Can't think of the brand name now at the moment. But the ones that are divided up into 4 or 5 straps that go across the body, they're less comfortable.
Right.
So do get the really good one. And it looks like, for all intents and purposes, you're putting a saddle on his back. And they're the most comfortable. They're the good ones. Okay. Did that cause the scratch or the rub? The older harness? Yeah, maybe it did. So get a good harness. Cod liver oil tablets, yeah. Cod liver oil. So you want omega-3 and omega-6 for every dog. The omega-3 and the omega-6 give the essential nutrients that dogs need to have a glossy coat. Now, any more than 1 tablet a day probably would cause diarrhea. You don't want that. So reduce it to a half a tablet a day if you find the dog's stools.
Especially because they're small dogs.
Yeah, they're small, so a half might be enough.
Yeah.
You don't want them, like, obviously fish oil, it'll cause diarrhea in excess.
Yeah.
Too much of it.
Okay, well done. And thanks to Tig for that lovely picture of the family of dogs. I have to say, it's a cracking good picture. To be fair to you, I presume that's your screenshot on your phone or something. Fair juice as well. Good morning, all. Pepsi is a nervous wreck. I hate this time of year. Nothing makes a difference. We get meds from a vet every year. He trembles and hyperventilates, and I'm worried that it could kill him. He is 8 years old, I presume. Hold on a second.
Yeah,
can we actually see what
is that Pepsi on the
on his
in
back?
the garden
I'll
on his
just
back?
click on this and see what it is. If it's
Pepsi.
Second. Oh yeah, look at that lovely little doggy.
Pepsi's a Yorkie or a half Yorkie, nice little dog. Nervous wreck, says the owner. Yeah, look at maybe think about starting Pepsi on the Reconcile. It seems to me that if he's been put on probably a couple of sedatives or a couple of mild sedatives every year for the Halloween, and he's not getting the benefit he should get from those, then he probably needs to reconcile, because I'd say his adrenaline levels, his cortisol levels are just too high.
Yeah.
He's too stressed.
And go back to what we were saying from the outset was let's do this from now, rather than just saying, let's 2 days beforehand, let's get some drugs inside of it.
I've had loads of feedback over the years from people that tell me that it's too late. By the time I started the tablets with the dog, it was too late. He was so wound up that the medication didn't work.
Yeah, so you need to build it up.
So this year
do you increase the dose as you go along, or is it a steady? No, you shouldn't have to.
Yeah, you wouldn't have to. Yeah.
Okay, fair enough. Have a greyhound 3-year-old that never came into heat and want her to come into it. What can I do? I suppose get it checked out first, I presume, is it?
There's a fertility specialist in Tipperary, in Care, County Tipperary. I think they're called Irish Greyhound Fertility, something like that.
Okay.
I would go and see them. You need to have an ultrasound and a hormone assay done on that bitch to see what's the story with her fertility.
Okay, fair enough. Straightforward, simple enough on that one. I have a 5-year-old border collie, and he is very sensitive to loud noise. Howls when the ice cream van comes along with the music, I presume, and comes around also motorbikes, but bangers frighten the living hell out of him. Tom in Newbridge. Yeah,
Tom, that's the hypervigilance gene that these working dogs have, working collies. Yeah. There was a survey of a research piece of about 1,000 border collies and German shepherds. Yeah. Somewhere on the continent, a German vet school, about 5 years ago. And they identified, it was a genetics department of a vet school, they identified a gene, basically what they call a guard dog gene. Yeah. And they've designated it a gene for hypervigilance. So there's actually a genetic marker in these dogs, bred into them over hundreds of years, to be watchful, to be on high alert. It's not anxiety, it's literally hypervigilance. Yeah. And yeah, your collie is very like that. Again, I don't know if you want to put her on Reconcile for the likes of that. No. Sometimes just, more exercise and keep her busier and keep her more active, and just, you can get that agitation and energy levels down by just probably a more strenuous routine of more exercise. Sometimes, these big dogs, these working dogs, it never ceases to amaze me sometimes how much exercise they need. Okay. Right, on to Paula. This is a delicate question. She says, my 8-year-old son is on the spectrum. I don't particularly want to name what he's got, but at the same time we were looking for a companion for him in the form of a nice little puppy that will come along with him. Yeah, so you want a nice, patient, calm, very domesticated, loving little dog who just wants to be around people all the time and isn't too energetic and too wired. Okay. So a little calm type of a dog. Basically, number one, what springs to mind would be a Cavachon. Yes. Yeah. So a Cavachon is a crossbreed of a Cavalier and a Bichon. They're healthy, they're hardy, they're patient, they're a little indoor dog who are easy to keep. So, that listener has a busy life and has a lot already going on in the house. So you want a little dog that's going to slot in and be calm. So I would suggest a Cavachon would be would be probably the go-to little puppy of choice. Okay, and coincidentally enough, we just got two questions very similar to each other. First of all, as an extra to the medication for your dog on Halloween, bring your dog for a drive and maybe head up the mountains or go for an area outside of where the bangers are and enjoy the walk. Well, I don't know if you can really do that at night time as well. No, and separately, it's harder in the evenings. And separately, we go for a walk. Oh, this is in my neck of the woods out in Port Arlington.
Jean was on. She says, we've often brought our dogs down by the lakes in Port Arlington for a walk on the Derry Ounce Walk. Subsequently, it seems to work, calms them down when we bring them for a long walk on Halloween night before it gets busy. That means by the time they get home, they're knackered and they're not too stressed out.
You're probably familiar with that walk.
Yeah, it's a good walk, but I mean, I don't know whether it'd be. I don't see many people doing it late at night. I don't.
Is there any lighting around there?
I don't know, because I wouldn't be thinking it's the world's most, probably, I suppose the walkways along canals and stuff like that are lit up, where maybe around lake walks and things they're not lit up. I don't know, even though it's local to me.
Getting into the winter is a problem, trying to find places where it's safe to walk in the evenings. And
that was Jean actually from Ballybritis. Okay, right, fair enough. Thank you very much for that too. Right, that's it. We're done and dusted. And thanks to everybody who's been contributing. 0833 97 97 97. And we will... Oh, yes, sorry, hold on a second. You mentioned to me about your pet puppy academy.
Oh, yeah.
Go on, tell us.
Yeah, so the animal care students of St. Conleth's, they're coming to us from tomorrow onwards. Yeah. Every Wednesday for their half day. Their training mornings, where we're going to do animal husbandry and hygiene, dog handling and training. Yeah. And then the third module is pet grooming. Brilliant. So they do those three modules with us at Kildare Vet Surgery and Gym Dog. And we're opening up the Puppy Academy to new puppies, members of the public. Now we're charging €50 a day for your dog to come in and have a full experience.
But that does include?
Yes, that includes a groom and socialisation, playtime.
It's good.
A nice half day with us. A nice half day of activities for your dogs, folks, at Gym Dog. €50 for the half day. And the more the merrier. If we get in good extra numbers of these puppies and young adult dogs coming into us, it'll help the students.
Okay, great stuff indeed. As always, this will go up on podcast a little bit later on this afternoon here on Kildare's KFM. We're back again next week with thanks to Des.
It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.